So in March of 2012, I had the surgery. I had the gastric bypass. The surgery was great. I did well. I had no complications. However, I was in the hospital 4 days. I was having difficulty taking enough liquids in, but that was more of a mental problem on my part because it felt funny. I was scared I was going to break something, but I wasn't getting enough liquid in, so I had to stay another day. Well, I didn't really know about it until a couple weeks after. When I started going back to my nutrition classes and I got on the scale then, I was up 10 pounds. But it was very frustrating, very scary, and one of those huge points of, oh, did I make a big mistake? But as soon as we took care of the water issues, it fell off. After the surgery, about the only issues I had intestinally was gas. You have the gas that offends everybody else, but there's also another gas that is really painful for you, and it's kind of more of an upper track thing. And at that point you go, I don't care if I offend anybody else, just get it out of me. But that was painful toward the beginning. It's not that I couldn't do anything, it just was like, what is that? And you just play the surgery card with that. It's like, oh, well, sorry, had surgery. Actually, my intestinal issues with diarrhea and upset stomach vastly improved since the surgery. The program I was in was very specific about your feeding progression. Clear fluids at first, then some shakes, which I have difficulty with, but I powered through. I took some nausea pills to help me get through my lactose intolerant issues. After a couple of weeks, I'd move on to cottage cheese and tuna fish and mashed or baked potatoes and yogurt, lots of tuna fish. I think since that period of time, I have not had tuna fish since. And then just slowly adding chicken. You cut up really small and chew the heck out of it. No bread, no pasta for 6 months at all. One thing that helped me, I guess, the way to get me through this is I didn't have specific goals. During that time was right when Pinterest came up, and I started pinning recipes and looking at these recipes. How can I modify this to make it work for me? Because like I said, I wanted to do things at each meal at 250 calories, 20 grams of protein. And so I became this big believer in muffin tin cooking. I would make them in muffin tins and freeze them. And so I still to this day do this. And I would take a recipe, I'd input it into an app that tells how many calories and how much protein, and then I would add and subtract things to make it 250 calories, 20 grams of protein. And I pretty much didn't have any side effects from the gastric bypass. The dumping syndrome happens if you have too much sugar or too much grease, and then you can get sick to your stomach. You get diarrhea or vomiting. Other things that can happen besides the vomiting, your heart speeds up, and I'll just have to lay down, maybe sweat a little bit. But if I'm thinking about it and paying attention, it really doesn't happen. And they said about 6 months after, you may lose some hair. And 6 months, it's like, why is all this hair on the floor? And I am very fortunate. I have this huge amount of hair, but it was a little disconcerting at the time to see these big tumbleweeds in my room of hair. I was like, oh my gosh, is it gonna stop? Is it gonna stop falling out? And it did. It did. I lost about 230 pounds after the gastric bypass. That includes the pre-surgery 60. And it's all over. I mean, I have skin all over, hanging down that would cause rashes, very uncomfortable, smelled horrible, very embarrassing. And it's also disconcerting in that you've worked so hard to lose this weight and you're still not comfortable in all your extra skin. I met with the plastic surgeon and we talked about all the things he could fix. And in the discussion with him, it was decided I'd have a series of 5 surgeries. At this point, I have had 3. The first surgery I had was called a 360-degree body lift, and basically they cut me in half, pulled me up, and put me back together and cut off all the extra skin. For me, he took off 35 pounds from my middle. I do have a scar that goes all the way around my middle. About 6 weeks after that, I had my legs done from my groin to my ankle. And he took 24 pounds off my legs. Both the 360 and the legs were about 11 hours long each. I healed very well on my 360. The legs were a little more difficult, and I was forewarned. I did have some things that opened up, but they healed, and they're fine. About 3 weeks ago, I had a facelift. I had the facelift, a chin lift, and my eyes upper and lower done. And so I'm still a bit swollen. In several days, next Tuesday, I am having my torso done and my breasts lifted. And then once that's healed, I will have my arms done. And then I will be done with all the reconstructive surgeries. And if my appendix blows, I don't care. I'm done with the surgeries. They're not easy surgeries at all, but every day I'm so glad I've had them. I feel better. I mean, my tummy is flat. I have a brand new belly button. And it's very exciting. I'm very fortunate I'm able to do it. Some insurances will cover it. Some people do have parts of it covered. I am unlucky in that respect. Medically, I had reason, especially for the tummy tuck and the 360. I had rashes, I had skin breakages, I had bad smells, yet they still didn't cover it. I was very open with my friends.